Hello, my name is Jennifer Lee, and I am a tobacco treatment specialist at the Center for Community Health and Prevention. And today I'm going to be talking about the effects of tobacco on our lung health. October is National Healthy Lung Month, and also National Substance Abuse Prevention Month. So I'm excited to be here with the Gut Health series to talk to you about our lungs. So the first place I wanted to start is actually just talking about our lungs and what's its function and why is it important that we talk about. So our lungs are our breathing mechanism, right? The primary function of the respiratory system is to deliver oxygen to our body and our necessary parts of our body, and then also to remove carbon dioxide. When we breathe, oxygen enters the lungs, then into our bloodstream, where it's pumped into our cells and helps us stay alive. Why cigarettes can be a harmful experience for our lungs is because we inhale the 600 ingredients that are in cigarettes. When the cigarette is burned, it creates more than 7,000 chemicals that we are inhaling. And we know that 69 of these chemicals are known to cause cancer, and many are toxic. So, what are these chemicals? These are a list of some of the chemicals that are found in tobacco smoke. If we're kind of looking through this list, a lot of them are things that we maybe don't think that are in a cigarette and wouldn't think about ingesting in our body. So, for example, acetone found in nail polish remover, um, ammonia, household cleaner, rat poison, benzene, which is found in rubber cement and gasoline, or, on the other side, lead found in batteries. There's a lot of these chemicals that we know we wouldn't ingest and are very readily found in the tobacco products. Nicotine, the one in green, is also the part of the cigarette that is highly addictive, and the part of the cigarette that can also occur with the withdrawal symptoms. That's what we feel when we're addicted to the nicotine and trying to wean off or cut down or quit. Nicotine has been historically used as an insecticide. Vaping and use of e-cigarettes can also be harmful for our lung health. The World Health Organization put out the statement that these systems are addictive and are not without harm. I think there's a misconception that the vape or e-cigarette use is safer or is safe in general with lung health, and that is just not the case. E-cigarettes heat up the nicotine, and these chemicals are basically create an aerosol that we inhale. What are the chemicals found in these vaping products? What I think is challenging about vaping or e-cigarettes is that there are so many different kinds of vapes and vape products out there that we're really not sure or have a solid understanding of what kinds of chemicals or how many chemicals are in these products. I mean, the one that we know that's in there is nicotine, which is the highly addictive substance that can negatively affect our, especially for adolescent, our brain development, and then the piece that we are addicted to and then feel withdrawal symptoms with when we're trying to quit or cut down. Other types of chemicals that are found in there is, carcinogens, other things that have been linked to decreases in lung function or lung diseases. Now, I think that's not the fun part to think about what are the effects of cigarettes and vaping on our lung health. And I also think that there are well known. Most people, or most of us, know that smoking is not very healthy for us. And it's really, really challenging to quit for a whole complexity of reasons. One of the reasons why I think it's important to talk about what we gain from quitting smoking is because it is so challenging to quit. So I like to spend some time to think about how does quitting smoking or vaping impact our lung health? So I love this graphic here because it really describes how even like within a relatively short period of time, we can see a really big impact on our lung function and our lung health. So within minutes of stopping your last cigarette or vape, your heart rate returns to normal. Within 24 hours, your nicotine level returns in the blood to zero. Within days, carbon monoxide levels return to normal. Within months, coughing, shortness of breath decreases to 50%. If we're talking years, your risk of heart attack decreases, heart disease decreases, stroke decreases. If we're looking at 5 to 10 years, other risks of other cancers, especially lung cancer, will decrease over time. So it's kind of this cumulative effect of the impacts of quitting or stopping smoking and vaping and its impact on our lung health or our overall health. I also like to talk about some maybe non-related impacts of our lung health, unrelated to smoking or vaping, which is exercise. So exercise has been like well proven to be impactful on our lung health for a whole host of reasons. But when we're physically active, we stretch our lungs and our heart to work harder and apply additional oxygen to the muscles that we're using or the systems that we're using to exercise. So it makes our lungs and our heart stronger, and it gets our respiratory system a more efficient way of getting to the oxygen and carbon dioxide removed from our body. That's one of the reasons why when we're regularly exercising, we find that maybe in the beginning we are more short of breath, but then it becomes easier and less shortness of breath over time. I was saying before that, quitting nicotine or these tobacco products are really challenging for many, many reasons. And I think there are a lot of resources available to help support reduction in tobacco products or quitting tobacco products. The Center for Community Health and Prevention has one-on-one counseling available with a nurse practitioner or a tobacco cessation specialist like myself. And that is our phone number on our screen. There's also this link is to other resources available, other readings, other information if anything was intriguing to you today. And then the New York State Quit Line is a really great resource and a free resource that you can call. And then here are my resources. Thank you so much for sticking with me and learning a little bit about the effects of tobacco on our lung health. And reasons why it would be important for us to work towards quitting whenever you're ready. All right, thank you so much. Bye-bye.